A beautiful shot from Rancho Mirage in our desert cam here at 8:46. Now, even as we continue to celebrate dropping COVID rates here in California, fewer cases, fewer hospitalizations, fewer deaths, and across much of the United States, there's still devastation surging in India. And the proportions of this COVID spike in that nation are nightmarish. The country had more than 360,000 new cases yesterday. Believe it or not, that's down from about 400,000 on Friday. India had 10 million cases in the first year of the pandemic. They have had 10 million more since the beginning of 2021, and most of those coming in just the past few weeks. We know that this is an issue that we need to be watching. Joining us now is the global health expert at India COVID SOS, Dr. Vineeta Gupta. Dr. Gupta, thank you so much for jumping on with us about this. You've been watching the updates very, very closely. Give us another, you heard me just run off some statistics, but give us another sense of how urgent this crisis is and what the conditions are right now.
So, Michaela, thank you for having me on the program. And I wish it was in a better situation. As you said, the cases are surging. There are more than 20 million positive cases, and then more than 230,000 deaths. And these are underreported. I should tell you from my own experience working in the public health system in India for over 10 years, the situation is really bad. It's just on every aspect. As you know, COVID has upended our life in every part of the globe. But we are behind the curve. It's in India today, it's going to go elsewhere next. So in India, we hear the stories about, people not having oxygen, doctors being sick, put in the same hospital so that they can still provide the guidance to the hospital. Health workers are stretched. The medical students are pulled in from their final year without training to treat the COVID patients, and it's like a disaster from both sides for the students themselves and for the patients as well. But what do you do, right? It's a stretch, all hands on deck situation. And somebody was telling us the story yesterday, a doctor from India, that some patients are asking to, even if they're lucky to get the oxygen bed, it's called like oxygen bed where oxygen is available. They sometimes ask doctors to take off the oxygen because of the debt. They're worried about the debt they will leave back for their family.
There's a really great, your website, India COVID Crisis SOS, has a great opinion piece on why the crisis there is really a cautionary tale to other countries. Quickly highlight that point.
Yes, so we've seen this circle going on. One is India is such a big population, right? And it's a hub of the Asia. So as we have seen from our experience, the border closures or other things have a limited value in stopping this virus.
Right.
So it's going to spread it is already spreading to Nepal and other neighboring countries. It's going to get elsewhere. We all will face this mutant virus that's spreading around the world. So it's just a matter of time. And if we don't get ahead of it, it's just a loss of life and things that will struggle for decades.
Gigantic proportions. Let's talk about, because we know there's a big Indian American population here in the Southland. We know there are people that have traveled there and have found it as a second home, and there's such great affection for that nation. What can people here do to help? We can't send oxygen per se. The governments are doing what they can. We hope more foreign aid will arrive. But what can local citizens do?
So we, as Indian diaspora, carry the weight of these stories, right? So we carry the burden of these stories and want to do the best we can. Sometimes we find the resources that we can help and feel that we are doing our pitch. So one is that we have put together at India COVID SOS a list of things that people can do, whether it's donating money or providing technical assistance or help us with policy changes that we need to do. For example, trips, right? So, we all have heard that story that if you want to make a sustainable change, teach people to fish rather than give fish. And we have heard it from State Department. We have heard it from others. But in this case, it's not even teaching to fish. It's pressure on countries like India and South Africa is not to even use their net, fishing net. What I mean by that, The TRIPS flexibilities, TRIPS, the IP flexibilities, if they are allowed to manufacture in countries who have the capacity to produce vaccines and other therapeutics, should be allowed.
Right.
And U.S. should step up to do that. And Indian diaspora has a huge voice in the policy shifts that U.S. Can make.
Well, then
So
that's why we want
urge
to point
everybody.
people to that website. I found it an incredible resource. Hopefully we can put it up on your screen. There it is, indiacovidsos.org. If you want to find yourself get more informed, if you want to find ways that you can be part of the diaspora to spread the stories and to spread the news of the urgent need there, or if you maybe have a way to help both financially or resource-wise, please visit it. Dr. Vineeta Gupta, I can hear the passion in your voice. I hear the pain as well, and I'm so glad that we can stand with you and shine a light on this, and we hope we can continue to get more aid going to India and help those people there that are in such urgent need. You stay well.
Thank you, Michaela.
My
Thank
pleasure. My pleasure. You stay well.